pharmacist Obiara Kinefuna, and I represent Emzor. I'm here to give a presentation about this company, foremost manufacturing company in Nigeria. Although today we will be putting more emphasis or focus on import substitution as a means to medical security. So as you may know, Emzor is a fully Nigerian-owned company with highly qualified and invested people who take ownership and pride in providing wellness to all. We've been in this business for over 40 years. We have currently over 200 products and 4 factories. We're a strong brand in the Nigerian household. Our journey started like most Nigerian businesses in this room. In 1977, we started as a community pharmacy somewhere in Yaba. In 1984, the dream to be the foremost manufacturing company in Nigeria was born. By 1988, we introduced our first product, which is Emzor Pharmaceutical. I didn't get the rest of it.
It makes you feel better. Yeah.
In 1988. But by 2018, we are proud to say that we had 4 manufacturing facilities, over 120 products, and again, a household name in Nigeria. We like to say or call ourselves the one-stop shop for medical solutions in Nigeria. Emzor Group is made up of 3 subsidiaries and 1 business unit. We all know the Emzor Industries, the one that produces the paracetamol. Also, another subsidiary is the Emzor Healthcare, which is involved with hospital equipment. Zolon Healthcare deals with the more ethical products, which before now, we didn't have the technical know-how to make in Nigeria. We were mostly substituted. But before the end of the presentation, you see that the story has changed. And of course, we have the Emzor vaccines. I'm happy that for those of us that were in Abiopta last year, we had the pre-screening. We also have the MCPD program. This year, I know yesterday some people were here for the MCP program. And I'm also happy to say that at our stand, we'll continue with the free hepatitis B screening. So please, at your due time, please come to the stand for your free hepatitis B screening. So the journey to import substitution, which is the focus for today. India has over 10,000 drug manufacturers that serve over 1.4 billion people. What about China? China has over 5,000 drug manufacturers. Sadly, in Africa as a whole, we only have 375. Coming home to Nigeria, our fatherland, there are only 115 registered pharmaceutical companies serving more than 200 people. 200 million, I'm sorry. And of course, what does this mean? It means that we'll have to depend on imports. Over 70% of drug supply is imported. 2019, COVID-19 happened. And there was the shutdown. Nigeria, in particular, was quite vulnerable to this. Because like we know, there was global lockdown, unaddressed regulatory affairs, poor access to resources by population, lack of stock, but most importantly, there was decreased local manufacturing. And we as Emzor Pharmaceutical, we learned from all of that. And we are asking the question, what would happen to our medical supply during the next pandemic? I reject it in Jesus' name. But there are benefits. There are benefits if we start making these products here. Number 1 is there will be better medical and health security. The quality, availability, and affordability of our medicines will be assured. There's technology transfer, and research development, as well as growth. I'm happy to say that Emzor Pharmaceuticals is playing a big role in this aspect. This is our Shagamu campus. This is an aerial view of our Shagamu campus. It's sitting on 60 hectares of land in Shagamu. Last week, we were happy to play host to the ESCOs for the ACPN, and I'm very sure that the chairman, in his own time, will probably talk about how impressed he was to see this. But something to say is the cephalosporin plant. Our cephalosporin plant is the first in this region. The very first in Nigeria, the very first in this region. Again, something we're really proud of is the fact that Emzor Pharmaceuticals is going to be the first Nigerian company to make APIs in Nigeria. We're going to start with about 4 APIs for malaria, and this should kick off by next only the products that we now make in Nigeria. This is Zomal, our diet atomicillin plus piperacin preparation. We have the tablet and the suspension. We have the mercury, 2 milligrams and 4 milligrams. We are proud to say that we make our gluconol, which is Suspex, is our celecoxib, proudly made in Nigeria, pyroxatam, our anti-infectives, nystatin, fluconazole, and azithromycin. And this is the Emzor brand, TS Piramal, just single dose, once a day for 3 days. And that. So, at this point, this is our anti-hypertensive, lisinopril, and amlodipine. This is fully registered in Nigeria and proudly Nigeria. At this point, I want to call my colleague, Emeka Famisusimeka, who will be introducing one of our products, Emzor Para 1000. Thank you.
Thank you very much, sir. I'll just stand on the existing protocols that we have. Okay, so like we all know, Emzor used to be known as the Para company, and our legacy has been for over 30 years and counting. Emzor Paranectasis grew quickly to become a household name. And from there, we decided to build on this heritage to find innovative ways to continue to lead in the paracetamol segment. And this also led to the formation of Emzor Para 1000. We had 3 major things in mind: improved patient compliance, improved a reduction in pill burden, and also to offer maximum relief to every patient who picks up a caplet of Emzor Para 1000, just in one caplet. So you might be wondering, what is new about Emzor Para 1000? Based on your feedback as our partners, as pharmacists, as our patients, as our customers, we have optimized the caplet size, which makes Emzor Para 1000 easier to swallow for every patient. We have also used improved technology to ensure that the dissolution rate is increased, meaning that there is now an enhanced release of every caplet of Emzor Para 1000 to give every patient rapid relief. And lastly, we also have the new and improved packaging. And additionally, we also have the Emzor Para 1000 now in mini strips. We originally had it in 1x10 caplets, but we also have it now in mini strips, which makes it easy for you to introduce it to your patients, to introduce it to everyone that you come across. So at this point, I'll crave the indulgence to invite the national chairman of ACPN, Wale Oladibolu, to help us unveil this and to introduce you to the product. As this is going on, we have our colleagues who will be passing around samples of the Para 1000, because like you all know, in Emzor, our mantra is unlimited wellness for all. Unlimited wellness for who? Unlimited wellness for all. Thank you very much, sir. So I'll be introducing to you the new Emzor Para 1000. So we would spell P-A-R-A, and then you would respond. Oh, then I have my executive director in the house also, Francis Uzoma is there to join us. Thank you so much, sir. So we would spell P-A-R-A, and you respond 1000. Yes. Okay, so we do. Oh, okay. So give me a P. P. Give me an A. A. Give me an R. R. Give me another A. A. Para 1000. Thank you. Thank you very much. Yes, we have samples. Samples are being passed in the hall right now. Also, you can come to the stand if you have any questions about this product. So we have samples, we have the ministry samples going around now, and we'd also like to get your feedback. So please come to the Emzor stand to give us your feedback on the ministry, and you also get to see the 1x10 tablet as well.
Esteemed colleagues, good afternoon. Now I'm going to take a risk. I'm someone who's always struggled with taking medicines. But I don't know what the R&D team did, but they did something. So I'm going to challenge anyone with a headache here. Honestly, it's a risk to take the product now and time it. Who has a headache? Dr. Monica, I hope we're not a headache. So it's just a challenge, but that's how confident we feel about the reformulation. So thank you.
Emzor Pharmaceutical at Emzor, and I'm being asked about the launch. Actually, it's a relaunch of a brand. A lot of Nigerians, my generation particularly, can finish this tune. Emzor Paracetamol makes you feel better. So this makes you feel even better because it's important to hold the legacy that you're holding. Make it important even as you're doing new things. So what we've done is offer a double strength caplet, 1,000 milligrams in a single dose. It's now offered in a smaller size caplet that's easy to swallow and has enhanced release. So you know, in our environment, headaches they can be common. Situations that generate headaches can be common. So what we've done is invest the time in optimizing our formulation. But this really isn't all Emzor's been doing. We're at the ACPN conference, which is the Association of Community Pharmacists. And our biggest message to them is that presently now, with Emzor and some other manufacturers as well, but particularly for Emzor, you will see a lot of firsts. I hope you'll have a chance to capture some of the brands that are displayed, many of which are being manufactured in Nigeria for the very first time. What that means is that we are investing and actually actualizing import substitution. Important for us as a country because so much talk has gone into the extent of importation. Over 70% of the medicines we consume are imported. Now that's not a good situation for the country, but it's something that with our new factory, or should I say factory campus on 60 hectares in Shagamu that's pursuing WHO pre-qualification, we now have the ability and through technological transfer agreements are now making products that have never been made before. And we're going a step further, which is to look at import substitution. So we've signed a technical transfer partnership with one of our long-term customers that will allow us to, for the first time in sub-Saharan Africa, not even Nigeria, see the production of what we call APIs, active pharmaceutical ingredients, the raw materials. That would be things like paracetamol powder is a raw material. But we're focusing on 4 ingredients at first, which are used to tackle malaria. Nigeria is still leading in malaria deaths on the continent, and that's completely unacceptable to us. So backward integration, make the raw materials, make the finished products here. One of our newer anti-malarials is also a first to be made in Nigeria under 2 brands, Piramal for Emzor and Zomal for Zolon Healthcare, a member of the Emzor group. Fake, and if you would permit me, there are 2 issues. There's fake and there's also substandard, which is anything that really does not meet the label claim of releasing the right quality of ingredients at the right time in the right part of the body to give the right result, or something fake which is not at all in any way what it says. Both of these are issues that we've heard so much about. So I think there's a very important step that was taken here. Earlier this year, our two major regulators, the Pharmacy Council, PCN, and NAFDAC, who everyone knows regulates food and drugs, they attained what's called ML3, Maturity Level 3. And this is a WHO assigned accreditation. And it is a reflection of the, as the word says, maturity, of the extent to which practices and processes are embedded into how the agencies operate in the country. This is really important in light of the upcoming Continental Free Trade Area Agreement. It will give other countries confidence when it comes to accepting products made in Nigeria and now being sold across a larger market space. So the issue of fake and substandard products, yes, impacts manufacturers, but to a much greater degree impacts the public. Sometimes you might buy something that you are expecting to deliver value, to bring wellness to you, or even healing when you're actually sick. And if it fails to do that, you've lost productivity. You know, you're not feeling well, sometimes you can't go to work. And if you look at how a lot of people earn money day by day, you don't show up at work, you don't get paid. The impact is massive. Loss of confidence sometimes is also a major issue for the industry. So it's really a multi-faceted problem. Yes, we have our regulators, but we also have manufacturers who must continue to ensure that what we produce here is of standard. And then we also have the general marketplace where we need to have greater oversight. I know for certain regulated products, we've seen the NDLEA increase their activities, but the truth of the matter is we can all do a whole lot more. The impact beyond what it does for the sector is what it does to the people. So it should be something that's completely abhorrent to us, that we continue to tackle and face like the scourge that it is. So I would say that certainly a lot more funding is needed for the regulators, a lot more sensitization, and a lot more structure. These products thrive in the murky spaces where regulation may not be as deep as it needs to be. So it's getting to all of us. You know, so yes, it's impacting the manufacturers because you're losing value, competing with products that label like you, but in the lab and in the body we can see are not at all like you, and somebody's losing out at the end of the value chain. So it really is a massive issue for us. Within the pharmaceutical space or the healthcare space, a lot of the CSR projects are actually in collaboration with many other bodies. Even this particular outing today at the Community Pharmacy Conference, it takes a lot to underwrite a project like that, which is why Emzor undertook the platinum sponsorship for the program. Okay, so let me talk about CSR projects within the healthcare space. Yesterday, I was one of, I think, about 150 pharmacists during this convention who were actually trained and will receive accreditation. We had done online modules, but we had live training yesterday that would enable pharmacists to administer vaccines. There would be accredited vaccinators. And when we look at what happened with COVID, and thank the good Lord, we were not hit in terms of deaths in the way that many other countries were. But if we had the same susceptibility that they did, we didn't have the infrastructure on the ground here to deliver the results that they did. Our vaccine coverage, I don't have the exact statistics, but I would wager that is definitely below 20%, and like something approaching 70% in, say, a country like the US. So if you have a situation where a life-threatening activity is happening, access becomes really important. Emzor was founded by Dr. Stella Okoli and began as a community pharmacy. I did my homework in the back of that pharmacy. I received injections from the nurse in that pharmacy. Somebody forgive me if she wasn't allowed to. But we understand the power of the community pharmacist, especially when well trained. During the plenary session today, it was said that pharmacists are some of the most overeducated and underutilized members in the healthcare continuum. So last year, Emzor underwrote the sponsorship for the first vaccination accreditation for pharmacists. And then we repeated some sponsorship this year. And this is an initiative that we will be continuing. I would consider that a CSR because of what it means to the healthcare industries in this country. Hepatitis B, for example, isn't something that most adults have been vaccinated against, and even a lot of our children are not vaccinated against that. Our infection numbers are somewhere between 14 and 20%. If you contract hepatitis, the kind of testing you have to do, viral loads to check your status, and then also liver function tests, is a liver disease, are astronomical. It's many, many times somebody's salary. You know, I'm not even saying the average salary, a graduate salary, many times to run these tests on a regular basis. So prevention is something we're committed to. So we do a lot of free testing, even at today's conference. There's free hepatitis testing and then highly subsidized vaccinations. So we want the pharmacists to take this. We can change the narrative in this country by leveraging on the power and positioning and education and access to community pharmacies. So that's a very major area of CSR for us presently. COVID-19, I think it was about survival. Not just physical survival, but business survival. So I really want to thank my colleagues in the industry. You know, when you have these Zoom meetings and people talk about working from home, we don't know what that is because manufacturers across this country were braving the uncertainty of not knowing exactly what COVID was and exactly how dangerous it might be, and coming to work, taking the best precautions that we could, but continuing to ensure supply. Some may recall some countries having crises where paracetamol, you say ordinary paracetamol, was not available. So I will commend the local manufacturers for everything that they undertook during COVID. I think the most important thing is that we kept things going through uncertainty, but that again is the role of the entrepreneur. The entrepreneur assumes the risk, and that's something that was well demonstrated throughout the industry. The other thing that we also did during that period was to begin to ask. The industry was affected, 70% importation of the drugs we consume, and during that time we weren't able to buy raw materials. COVID began in China, and a major producer of raw materials. And when the second wave, I think it was, hit India, we found that manufacturers of these key inputs were not able to come to work, or rather their teams were not able to come to work. There was a lot of constriction in the supply. And you know, supply and demand, when there's not much, the price goes high. So for countries that perhaps didn't trade in the, in the right currency, or whose exchange rate or leverage was diminished, we found that we weren't able to get. So we did two things. We decided to accelerate our research and development and begin to manufacture locally products that weren't being made here. Some might include misoprostol, our brand is Misoprostol. It treats postpartum bleeding, which is the leading cause of maternal mortality. It's the number one reason why women will die after childbirth. It's a tricky product. We executed it through a technology transfer partnership, and we're so pleased to see that it's being registered here, and registrations going on in other African countries, because these are some of the diseases that impact us. And also, we also started to manufacture more cardiovascular products here. I think we have about 4 cardiovascular products that we make that nobody else makes in the country. We increased our production of supplements, added zinc. Nobody was making zinc in the country. Mbitsi is a legacy brand for Emzor. So we expanded our vitamin C production and also started to make combinations and higher strength doses. We also made things for the gastrointestinal area. I'm trying to think of what else. We expanded the range of anti-malaria, so many other things. So we said we cannot continue to beg for these products, we must manufacture them here. Then we've taken a step further, which is to go into backward integration and now begin to manufacture raw materials here. So through a tech transfer partnership, that in less than 12 months, we'll see 4 key active ingredients that are used to manufacture the products that treat malaria will be going on in our Shagamu campus, sitting on 60 hectares, solid tablet plant, 2 specialized antibiotic plants, an IV plant that's nearing completion, and room even for vaccines manufacturing and so many other things. So I think the most important thing we did during COVID was hold it down and ensure that output was increased in the country. And secondly, we learned we decided that we could not stay where we were, and the industry needed to take a leap. So we believe that Emzor has provided that leadership. We can see the vibrancy, but I would also at this point say that it is very challenging for manufacturers, anybody import dependent. Yes, these are tough times. I said, I think in an earlier segment, that it is the role of the entrepreneur to assume the risk. With humility, it's also the role of government to support the entrepreneur. There's no mega economic power that has done so without the strength of local entrepreneurs, and especially within industry. We keep inviting, and you have been coming, so I know the confidence is growing. You know that I think 60% of the consumption in the ECOWAS region, I think actually happens in Nigeria, which means we have the opportunity or the threat of being a target market depending on how we position. So it's really important that all the grounds that were gained through COVID are not lost now. We're having an economic crisis, but a crisis is an inflection point. We have to take a decision and we have to support. It's also an opportunity to head in the right direction. And for Nigeria, that means a road less traveled. So manufacturers such as Emzor Pharmaceuticals, with all the new things we've done in the past few months, are not just looking to travel, move on the road less traveled. We want to go where there is no road, and we promise you we will leave a trail. So we need your support. It's not misplaced. Local content bill is there, 40%. Oh, I'm going to talk to our institutions and all the professionals. You need to support and buy local. Come visit our Shagamu factory. We've been hosting you. Keep coming. It's a reality. It's not just a dream. And we know that when you see what's at stake, and when you see the stake that's gone into the ground, you will join us and we will stretch our tent pegs and do what we need to do. Well, I think the first major hurdle has been overcome. This is actually the second edition. Emzor underwrote the sponsorship for last year's edition. And so much is said about Nigerians going to work in healthcare in the diaspora, but a lot of the training and support was actually driven through an association, NAPSA, a lot of US-based pharmacists, Nigerian pharmacists who came back and drove the training. They've been doing this in their own practices in the US for some of them decades. So we have the opportunity to have the right kind of collaboration. It's not only dollars we need to bring back into the country, we need to bring back our people when they are experts in their fields. So it was a second edition. So the major obstacle was even understanding that pharmacists were, competent to be vaccinators. So the best way was to show by bringing in pharmacists who already have demonstrated this competence over and over again. And during COVID, pharmacists were a bedrock of growing vaccination numbers. The beauty of a pharmacy or community pharmacy is that you can walk in with no money in your hand and you can get expert counsel. That's priceless, absolutely priceless. I don't know when we're going to monetize this expertise that we have, but it lowers the barrier to access, and that's what you need when you want to expand anything. Vaccine preventable diseases cost a lot unnecessarily. A lot of lost days and years and lives, and simply having pharmacists execute this service for which we are well positioned, it's a no-brainer. So we're sure that all they needed to see was the proof of concept becoming a live concept, and we're going to fly. So I really commend my pharmacists for that. Emzor, I think, is a great Nigerian story. It represents what can happen with consistency over many years. I think Emzor's story is a legacy story. It's a story that can make you proud to be Nigerian. I can't imagine working anywhere else. So we need, I think what I would also say is we're looking for the brightest and the best. So much expansion going on, but if we allow our brightest and best to leave the country without realizing the opportunities they have here to learn and to grow, I think we would have lost something great. What's the point of having a legacy story if people don't want to connect and buy into it? And of course, shameless plug, buy local, buy Emzor, quality assured, feel better, do better. See you at the pharmacy.